today is a different topic that I want to discuss, okay? It's about teething and solid food. I had a mom who messaged me privately regarding what is the right food for babies who really refuse to eat because the baby is teething. This is a very common scenario for moms with 6 months old baby or 7 months old baby started to eat solid food, and then around maybe 8 or 9 months some babies start teething. Some babies who have delayed teething maybe around 11 months. So today we are going to talk about teething and solid food. I have this very, very colorful teething toy that I really, one of the breastfeeding mothers who come to our breastfeeding clinic, when her baby gets older, she gave this to me and she told me, you can use this one for my teaching. So thank you so much. So this is one of the teething toy that she used for her baby. During that time, she came to our breastfeeding clinic around 6 months and a half. The baby was 6 months and a half because the baby was starting to lose weight. Why? Because the baby is starting to be very fussy with eating and with breastfeeding and with bottle feeding because of teething problem. So I'm gonna show it to you what it look like. I don't know if you can find this one with whichever country you have right now. So that one, okay. So it's really right the size of baby's mouth, okay. Baby loves to chew this because it's like a rubbery kind of texture. And when the baby start teething, what I found they really love their gum to be massaged just for comfort, And the reason why most of these babies refuse to eat when teething comes, because they really find it so uncomfortable, painful, sore to chew or to even just to eat. Even just a touch of that nipple in their gum is painful for them. So that's the main reason why so many moms are struggling how to feed the baby, what to feed the baby, and what to do with teething. Now, I know for many moms nowadays, especially in underdeveloped countries, meaning poor countries, most moms cannot afford to buy a teething ring or teething toy or anything that would really comfort the baby, okay? You can use a different strategy to calm your baby if you cannot afford to buy this teething thing, because I know they're expensive, they're very expensive. So what I would suggest, I had a mom in our breastfeeding clinic, and what she used, because she said she cannot afford to buy this kind of expensive teething rings, right? She used the real fruit, let's say strawberry. Or if you cannot afford strawberry, let's say cantaloupe, okay? What else? Melon, okay? What else? What other fruit? You can use maybe apple. Apple is a little bit harder. It depends on how comfortable the baby would start sucking that apple, but be very careful, okay? Be very careful. Little chunks of that fruits will, sometimes it's danger for choking. It's danger for choking. Now, if you use this kind of soothing thing, like you give your baby a slice of watermelon or a slice of cantaloupe or a slice of, what else that's softer? Pear, a slice of maybe peaches. So those kind of fruits, they're very soft. But be very careful when this baby start choking that, and you can see little chunks of that, and the baby swallows it. It may cause the baby to choke. So be very careful. Now, another thing that I heard that in Asia, overseas, some moms, I saw them, you know what they did in the past? They put a little face towel, they roll it and put a little bit of water in it, okay, and then put it in the freezer or put ice in it, and the baby starts sucking it. Mom would put that one around her finger and the baby would start sucking it just for comfort, just to massage this gum area. Now, when this gum discomfort goes away, your baby's appetite will come back. When this baby is still experiencing the discomfort of the gums, your baby may continue to refuse to eat, to refuse to breastfeed, to refuse to use the bottle, to refuse to eat anything. Because again, they're crying, they're drooling, they just want comfort. So sometimes that drives moms crazy. Sometimes moms don't know what to do. So simple tips that I advise to my patients in our breastfeeding clinic is just have more than 100% patience with your baby, okay? Cuddling your baby, comforting your baby, do as much as you can to really give comfort to your baby, especially for the pain. Nowadays, you can see so many gel, some doctors will prescribe medication just to ease the pain of the baby. I will not name whatever of those gels that you can buy in the market. There are just so many. Make sure you ask your healthcare provider, your doctors, on what's the right comforting medication for your baby if the baby is severely in pain or discomfort because of teething. It may take days, it may take probably a week or two when this baby feel really comfortable eating properly. But during the time that it just started, during maybe 7 months, 8 months, 9 months, and sometimes you're so worried your baby's weight start dropping because the baby don't have no appetite to eat. As much as you can, if the baby is able to eat solid food, I would suggest put milk on the solid food. Either formula milk, whatever you use for feeding, or your own breast milk, put it in the solid food. Then what you can do, this is what my advice is. What you can do before you even start feeding this baby, make sure that this baby is relaxed, okay? Maybe you can massage the baby's gum. Just gentle massage it. Maybe you can use ice chips. Just run it around the baby's gum. Once the baby starts being comfortable, after you do that, maybe for a minute or so, then start feeding the baby. If the baby continues to get fussy, crying, throwing away, pushing you away, start comforting the baby again, you know? Cuddling the baby is one of the best ways for support. I know this baby is gonna be fussy. There's some babies who even get sick with teething. Diarrhea, vomiting, even having a fever because of this. It depends. So make sure that you just monitor your baby's behavior. Don't give up. It will go away. Believe me, once those teeth will come out, it will go away. The next thing you have to worry is when this baby start biting you with those teeth. So it's always good to just play by ear, see how the baby's comfortably. Let's say when you're feeding your baby, you're positioning the baby, how you latch the baby, how you feed the baby. Now, I've seen so many of the spoons that in the market when I tour around and look at all different types of spoon that the baby moms use for babies when you're feeding. I've noticed though, those spoons that has metal on the sides, it may hurt more for the baby when you use that spoon. I would suggest the plastic is the best one. There's even some baby spoon that I saw in the market, kind of rubbery kind of texture like this. This one is like very soft, kind of rubber. That's the best spoon to use when you're feeding your baby. Sometimes the baby will just suck the food. There's some moms who use frozen food that the baby will just start sucking it, make it comfortable while the baby's eating. You can do that one too. You can mix your milk with it. So just remember, based on research, okay, every time you freeze your breast milk, there's a little bit of decrease, lessen the anti-infectant factor of your milk, okay? it lessen a little bit of that nutritious component of your milk when you freeze it, but still very healthy. That's based on research, okay? But other than that, it's still the best milk in the world when you use even cold milk, frozen milk, however you want with your breast milk, is still the best nutritious milk for your baby, okay? Going back to medications, there are a few moms who ask me questions about what should they do. Some of their friends would say, buy this kind of cream. Are they going to use cream, gel, or oral intake of medication for the baby to calm down or to help the baby relax? It depends. If the baby is drawing a lot of saliva, when you're using liquid, probably gonna be will stay longer in the mouth. But if you use gel, it may stick more to the gum, and it's much better effect than using the liquid. If you're gonna give this baby pain medication, depends on what your doctors prescribe. That may be one of the best ways, because when the baby starts drooling a lot of saliva, it's going to be useless whatever you put around the gum, especially if it's liquid. But gel may take a little bit longer. It depends on how old your baby is. So make sure you read reliable research on what to do, what medication to use. Your healthcare provider is the best person to ask this question in regards to medication. I am a lactation consultant, and I'm not allowed to say any medication because I'm not a doctor, okay? Thank you for listening today. I hope you learned something from this video. Please share this video. Do like if you like this video, and do your comments. See what videos you want to watch from me. I know there's so many moms right now in the world who really wants to focus on breastfeeding. And if you are a mixed feeder, formula and breast milk, I salute you for making sure your baby is being fed. There's a reason why you're doing mixed feeding. So if you have any questions about bottle feeding as well, I'm here to answer your questions. Thanks for watching, and more videos to come. There will be more topics that I want to discuss, especially almost the end of the year again. I'm very glad I have this platform in YouTube that I'm able to help so many moms out there all over the world when it comes to breastfeeding, bottle feeding, and formula feeding. Bye for now. See you next time.